Welcome to this special edition of Neurology News Network. I'm Marco Meglio. First up, pooled analyses from the Extend-IA TNK randomized control trial showed that treatment with tenecteplase 0.25 milligrams before endovascular therapy improved 90-day functional outcome and mortality better than 0.40 milligram doses in elders aged at least 80 years old with large vessel occlusion stroke. At the time of randomization and treatment, 27% of the 502 originally enrolled patients were older than 80 years of age. After adjusting for relevant covariates, tenecteplase 0.25 milligrams was associated with improved modified Rankin scale scores at 90 days compared with tenecteplase 0.40 milligrams and alteplase. Notably, there were no difference between the alteplase and the tenecteplase 0.40 milligram groups. Overall, only one-third of those older than 80 years of age achieved disability freedom or were functionally independent at 90 days, with the highest proportion of patients observed in the 0.25 tenecteplase milligram group. This difference was found to be statistically significant when compared with patients treated with alteplase. Next up, pooled data from more than 15,000 initially non-demented elderly individuals showed that significant changes in body mass index or BMI, along with greater variability in BMI, were associated with worsened cognitive decline. Furthermore, the stability of BMI may confer protection against cognitive decline irrespective of the initial BMI of the individual. Lead author Mikhail Schneider-Berry, professor of psychiatry at Mount Sinai Icahn School of Medicine, and colleagues followed the cognitive trajectories of individuals aged at least 60 years of age from the Alzheimer's disease centers for 5 years on average. At baseline, 36% of the participants had normal weight, 39.4% were overweight, and 24.6% were obese. Up to the last BMI measure, 26.7% of the total sample decreased by 5% or more, 55.8% remained stable in BMI over time, and 17.5% had BMI increases of more than 5%. The authors noted that these results suggest a potential clinical value in tracking BMI in annual medical visits, which is simple, non-expensive, non-invasive, and quick to measure, as it may point to individuals whose cognition is declining and allow for early intervention. Disentangling the biological pathways underlying different trajectories of BMI in old age and their contribution to brain health and disease is necessary to develop potential therapies. And lastly, data from the longitudinal Overcome Studies 2018 migraine cohort showed that relative to previous population-based findings, consultation for migraine may now be more likely to include ambulatory clinics. Diagnosis rates have shown slow and consistent improvement over time, and the use of prevention medication may be slowly improving. Notably though, the subgroups of patients with the highest disability reported some of the lowest use of preventative medications. Led by Richard Lipton, director of the Montefiore Headache Center, the data also suggests that episodic migraine is a condition with substantial heterogeneity and should not be approached with the same mentality for each individual. In the analysis, Lipton and colleagues identified several opportunities for optimizing migraine care, including patients seeking care in primary care, more people getting diagnosed with migraine, and being prescribed potentially beneficial acute and prevention medication. When observing treatment patterns, investigators found that 97.1% of the cohort had used an acute treatment for their migraine in their lifetime, although 76.8% reported had used a migraine prescription medication in their lifetime. Only 40% currently use prescription medication. Lifetime use of triptans was reported by 35%, whereas 22% reported current use. For more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.